Hello again, everyone, and welcome to Fayette Regional's Health Talk. I'm Charity Moore.
And I'm Doug Fischesser. Thank you for joining us. Health Talk is made possible by TV3 and Fayette Regional Health System so that viewers in the Whitewater Valley can be better informed of the health and wellness topics and opportunities in our area.
Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk News is the announcement of two of Fayette Regional's patient care offices have moved. Dr. Shiv Kapoor and his internal medicine staff has moved to a newly renovated location at 2004 Indiana Avenue, conveniently located across from the hospital. Patients will receive the trusted quality care that they have come to expect for many years from Dr. Kapoor and his staff. Accepting new patients, Dr. Kapoor invites you to call 765-825-4044 to make an appointment.
Fayette Regional recently moved Dr. Mary Chambers and the Pediatric Health Group team to 3542 Western Avenue inside the new Fayette Regional Women's and Children's Center. Dr. Chambers and her staff joined the physicians from the Healthy Women OB/GYN in this newly renovated facility to offer the area's most comprehensive and convenient care for women and children in the Whitewater Valley. The Pediatric Health Group can be reached by calling 827-8097.
Fayette Regional Health System is proud to sponsor and take part in several upcoming April events in the area. Richmond City Employee Health Fair takes place Monday, April the 21st. Fayette Regional is excited to once again participate in this exclusive event for Richmond City. Fayette Regional will also host a volunteer appreciation luncheon Wednesday, April the 23rd at 11:30 in the Roberts Park Miller Building. April is National Volunteer Month, and we would like to extend a big thanks to all our volunteers. Volunteers can RSVP to myself at 765-827-8058.
The public is invited to a health fair at Central Christian Church on Saturday, April 26, 8:30 to 11:30 a.m. This event is co-sponsored by Fayette Regional. The health fair will include free health screens, wellness education, demonstrations, door prizes, and more. Contact Charity Moore at 827-8058 for more information.
The month of May brings a few area events. Are your legs ready for the summer? Well, Fayette Regional will host the Varicose Veins Seminar Thursday, May 1st, starting at noon with a complimentary lunch, followed by a brief presentation and free consultation with Dr. Dennis Kneffler. You must RSVP by calling 827-8097 to reserve your seat. Speaking of women's health event, will take place Tuesday, May the 13th from 9 a.m. to 1 p.m. inside the Brookville Public Library. The public is invited, and a variety of vendors will be on hand to offer free health screens, wellness education, demonstrations, and nurse practitioner Christy Flum will be the keynote speaker. Door prizes and refreshments will also be available. Contact Melody Galt at 765-647-4031.
Physical night for Connersville High School and middle school students will again take place at Fayette Regional Hospital on Wednesday, May 14th, 5:30 to 8:30 p.m. The cost is only $15, and a portion of the fees go back to each school's athletic fund. This comprehensive physical meets the requirements for pre-participation medical examinations and is valid for the entire 2014 and 2015 school year. Call 827-8058 for more information.
And rounding out our upcoming events is Union County's Health and Safety Day, Saturday, May 17th from 8:30 a.m. to 1 p.m. Fun for the whole family, this event is on the courthouse lawn in Liberty, Indiana. A large number of vendors will be on hand to offer free health screens, wellness education, safety demonstrations, games, and guest speakers. Door prizes will also be given away, and there will be plenty of healthy food vendors on hand. Contact Tracy Christ at 765-458-7251 or check out their Facebook page for more information.
Finally, we would like to send out a big thank you to all our sponsors who supported Fayette Regional Foundation's Black and White Masquerade. Just to name a few, our table sponsors, whom are our vendors and donors at the hospital, auction item donors, our gala committee and team member volunteers, Old Richmond Inn, Dave White, a local auctioneer from Brookville, Indiana. Without all of their support, our event wouldn't be such a success. Thank you. When we come back, we will have guests Brent Duncan and Tammy Tressler in the studio to talk about the Sports Physical Night. We'll be right back.
Welcome back. Joining us now is Brent Duncan, the athletic director at CHS, and Tammy Tressler, the physical therapist assistant at Fayette Regional. And they're here today to talk to us a little bit about Sports Physical Night and the partnership that we have with CHS, CMS, and Fayette Regional. Thanks for joining us.
Thank you.
Thank you for having us.
Brent, I'm going to just go ahead and start with you. I know that we've been teaming up with CHS to provide sports physicals since at least 2005, and then most recently we pulled in CMS as well. Can you maybe explain to us how that process got started or the importance of that effort?
Well, to the best of my research, Pam Noble, the previous athletic director, started it in about 1996 or 97. For a few years, it was just all held out to high school, and the doctors came out to the high school to do all the physicals and eye exams and everything else they do. Then for 3 years, I went to the Whitewater Center on 44, and then since 2006 or wherever we've been at the hospital, which has been much better for our kids, especially probably much better for the doctors since they don't have to haul all the stuff. So it's been great.
Sure. What is the importance of a student athlete having a physical? Is that something that's just required by the school for safety, or is there something bigger to that?
No, to be able to participate in the IHSA, you have to have a physical on file along with insurance. It has to be done every year. It has to be done after April 1st, so the deadline for next year just passed. So anybody that's had a physical from now till next school year will be good through all the 2014, 2015. But there's been talks to even in the future to require them to have physicals prior to doing any type of summer camps or summer PE, or it's even discussed about having for high school for PE kids. So it's important just so that we might catch something that a student or an athlete might have, but you never can check everything, but it is required by the HSA in order to participate.
Okay. Well, you kind of led into the check end of it. Tammy, what can you tell us behind the scenes? What are some of the things you're looking for?
Well, the nurses will check for the blood pressure and vitals and all of the height and weight, all that stuff. And then the therapist will check from their joints, starting with the foot, ankle, knees, hip, back, shoulders. We check for scoliosis. And then if there's any deficiencies, then we flag that and it goes to the doctor. And then he rechecks to confirm whether he can clear them or not.
So if a student has an issue where they have been flagged and they see a physician on site, the physician then do they have the opportunity to clear them based on what they suggest, or at that point you just can't participate? How does that?
They can clear or suggest further, investigation into the problem, and the student is, has his right to a second opinion. But ultimately, the doctor has to clear that after we flag it.
Okay.
There is a check mark, not to interrupt, but there is a check box on the physical that has to be checked in order for us to be able to accept it. And if not, then they use a little writing in there that has to have further follow-up before they will release them back to us.
Okay. So then let me back up to start the whole process. Where do the students get the forms to start off with?
Well, right now you can pick them up at either the middle school
Okay.
or the high school. This is the first year that we've gone to the same exact physical form.
Okay.
You can also visit ConnersvilleAthletics.com,
Okay.
and it's posted on the website. You can print it off on that page. It's actually 4 pages long because it wouldn't let me upload all 8 of them at one time. So just make sure you click on all of the sections, and you can print it out offline.
Now, is that going to make it easier having both the middle school and the high school with the same forms? Because I remember last year it was like, well, high school student had the middle school form or vice versa.
It does for us because we ask a few other things that the middle school's not required to do by the IHSA. So we have a few other things. So we just felt like it'd be better if we all did the same thing, and then it doesn't matter if they pick it up at the middle school or if they pick it up at the high school, because we probably had 50 that were on the actual wrong form, and then you have to take it back and redo it. And don't have to redo the physical, but all the other paperwork that you took time to fill out. So I think it'll work better, and hopefully in the near future, most of those documents, we're looking at a new company that will allow those to sign those online,
Okay.
and they'll just be sent right to our file with a new program we're looking at. Outside the actual physical itself, the documents can be signed online.
Okay, so as a parent, I can pick up at several locations, the schools. We probably would have maybe some at the hospital the day
We
of.
can bring you some. There will be some
Okay.
there the day of for sure.
Okay, so then they get their packet, they start filling it out, they come to the atrium at 5:30 on that date. They pay their $15, they receive a number. Then do they go off to you to go through the different stations?
Yes, they'll start at stations and go through each station. And I wanted to add that the eye center will be there to do eye screenings too.
Okay. Now, once they've gone through the circle and everything's good to go, is this when they hand off the paperwork to their school?
Yeah, there should be. I will be there, and my secretary, Wendy Sargent, will be there. And there should be a representative from the middle school there.
Okay.
They hand us our forms. The middle school's a little different than the high school. The middle school still will give them a red card,
Okay.
which allows them to participate. The high school now, just once you get the physical, we enter it to a file, and then we print out a list for our coaches who has and has not had physical. So we don't actually give them a red card, and all the parents of freshman kids especially, my son or daughter didn't get a red card, can they play? Yes, they can still play because we just take care of that. I understand they're 14-year-old kids, and that red card may not be here from April to next August, so
Right.
we just give a printed out list of the students have had their physical, so the coaches can go through the list and check them off as the students show up to try out for events.
Okay. Now, you may not have the answer to this, but will the middle school have red cards there that day, or is this something that'll be given to them later?
They normally, if I remember right, they normally will have them there that day.
Okay. Okay. And then if there's any questions from the school end of it, do you have an opportunity to say, yeah, this wasn't completed right, or, do you stop that? Or
Before I take them, or Wendy will take them, we'll make sure all the T's and I's and all the
Okay.
boxes are signed and all the signatures are where they're supposed to be, or we'll give them the whole physical back until they get all the forms signed correctly before they can turn it in.
Okay, so if there is a mistake, it's one-stop shop. They
Yep.
can correct it all right there.
Yep.
And then I do know that the hospital issues sports T-shirts that
Correct.
day as well. I really like the design, so
I haven't seen this year's design.
it's pretty cool.
seen it yet either.
We're kind of pulling in our Spartan tradition,
Cool.
building on the champions that we've had in the past, so hopefully everyone will like that. All right. Well, thank you guys so much for participating today and joining us. And have I left anything out?
Not that I can think of.
All right.
You got it.
Well, thanks so much for joining us, and we'll
Thank
be
you.
right back.
Fayette Regional is your community hospital, serving the local area for 100 years. Founded in 1913, Fayette Regional has been providing great health care to the Whitewater Valley for a century and giving back to the community with outreach, support, and donations, as well as employing over 600 people in the local area. Fayette Regional, your community hospital.
Hi, and welcome back. We would like to welcome Kathy Stevens to our studio. Kathy and Doug are going to give us a little bit of background into the volunteer program at Fayette Regional. Welcome, Kathy.
Thank you, my pleasure.
Doug, you're the foundation director and you oversee the volunteer group at the hospital. Can you give us a little history behind the volunteers and what roles they actually play and their focus on the auxiliary?
Well, Charity, the auxiliary was formed back in 1958 by a lady named Velda Webster. She was the administrator at the Fayette Memorial Hospital at the time. She had long felt the need for an organization devoted to the interests of the hospital, one that would encompass all the women of the community who would be willing to dedicate themselves to help both physically and financially by their volunteer services. In September of 1958, with approval of the hospital board, the hospital auxiliary was organized with the intended functions of public relations within the community, volunteer services both inside and outside the hospital, and fundraising through various approved ways. And within 6 months, the group grew to over 250 members.
Oh, wow. Well, since you mentioned the numbers, how many volunteers are involved today?
Well, we currently have about 120 members in the auxiliary and the volunteers, and about 80 of those are active. Of course, we usually add about 10 new members a year, and about the same number drop out.
Okay. Well, can you give us a little idea of what they do in the daily activities at the hospital?
Well, the volunteer group today has become a very vital part of our daily operation, supporting both hospital and patient needs. Their duties include greeting and directing visitors at the information desk, the gift shop operation, delivering mail and flowers, shredding documents, and monitoring the waiting areas in the facility. They man and oversee 12 different areas of the hospital.
Wow.
They also participate in many programs for our patients, which include Christmas stockings for babies, teddy bears for oncology, plush animals for ER, and pillows for surgery patients. Over the years, they've had very graciously supported our expansion programs, equipment purchases, the scholarship funding usually for high school seniors who are entering the medical field. They are very much an integral part of our operation and play a very, very vital role in our success in the community.
Well, you touch a little bit on the financial support within the hospital. The hospital did recently receive a sizable bequest from a former volunteer, and I know that we've talked about this person before, but you want to go ahead and remind us and tell us a little bit more about that?
Back in 2011, the foundation received word from that the Sefton sisters were donating $500,000 to the hospital. Hilda Sefton had been a very active volunteer for over 30 years. She was recognized in September of 1996 for the most volunteer hours within the auxiliary at FRHS. She retired from volunteering in 2007 and had accumulated close to 14,000 hours at the hospital.
Wow.
At that point in time was the most of any volunteer over the years. A portion of that bequest was used in the renovation of our emergency room facilities. And beyond, to support the hospital in every way, she's just one example of the unending dedication to our facility. It goes without saying that the volunteers are in many ways the foundation of our facility. In the past 7 years, the group has pledged over $100,000 to help fund the number one, the Heart Care Center, our third floor renovation, and as I said, the ER renovation programs. And also, too, they've helped in equipment purchases such as wheelchairs, treadmills, just to name a few. In terms of hourly support, the group donates about 12,000 hours a year, and those hours are logged individually, and they are recognized for different levels of service at their appreciation luncheon in April coming up.
Okay, well, since you mentioned that luncheon, tell us a little bit more about that.
Well, the month of April is National Volunteer Appreciation Month. It's billed as celebration service nationwide, and it's about inspiring, recognizing, and encouraging people to seek out imaginative ways to engage in their communities. It's about demonstrating to the nation that by working together we have the fortitude to meet our challenges and accomplish our goals. And in a small way, that's what our volunteer group at the hospital does for us every day.
So how would a member of our community volunteer at the hospital?
Well, that's pretty easy. First of all, drop by the foundation and see me or yourself if I don't happen to be in there, and pick up a volunteer packet. You'll need to fill out an application form. It's just a one-page form, and then take 2 TB tests a week apart. Once those are done, Kathy Stevens, our president, which we'll be talking with her pretty soon, will contact you, and she will sit down and discuss the various opportunities to serve, and she'll schedule your volunteer times. I'm very fortunate to be able to work with such a very giving group of people. I often comment that the hospital couldn't run without our volunteers.
I totally agree with that. Well, Kathy, let's go ahead and get started with you. Tell us a little bit about yourself from the beginning. Where are you from?
Okay, I was born in Beech Grove, Indiana, and then we moved to the south side of Indianapolis rather. And when I got married, I moved to Ohio for 10 years, and I am married and have my husband's name is Mike. I have 2 children, a son that lives in Indianapolis and a daughter that lives in Colorado. My son has 3 children and my daughter has 2 children.
Well, what brought you to Connersville?
Well, my husband's job, we came here in 2002, and my daughter at the same time moved to Florida. I didn't want to be tied down to a full-time job, so that's when I became a volunteer. I'm sorry, I'm answering.
Well, when and why did you become one of our most dedicated and valuable volunteers? Can you tell us a little bit about that?
Well, I really enjoy volunteering. I feel there's really a need in this community for that, and I really enjoy working with the other volunteers, and their cooperation is just wonderful. I mean, it's just a wonderful contribution to this community.
I'm looking at our notes here from before. It looks like, did we actually start with the Red Cross? Can you tell us that transition?
Well, there were 2 organizations when I started. There was the Red Cross and the Auxiliary. We were 2 separate entities. And then in about 2006, they decided that it was silly to have 2 totally different organizations, so we combined as one.
Okay. What are some of your duties as the Auxiliary President?
Well, I interview new volunteers. I assign them some jobs and organize fundraising events and just kind of try and keep everything on an even keel so that we do have the amount of volunteers that we need in each position.
Well, real quick, I know you mentioned the fundraisers. So then are you guys the one that takes care of like the book fair we have, the jewelry sale,
Yes.
that sort of thing in the atrium?
Yes, we cooperate. We do the you can do payroll deduction, so we do that part of it, and always we get a percentage from our vendors. They've been very cooperative, and they really do help us to purchase the articles for the hospital and to sponsor the scholarships. So, yes.
Nice.
Well, thanks for joining us, Kathy. Anyone needing more information about volunteering at the Fayette Regional can call me at the Foundation office at 827-7798.
Well, that's all the time we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Charity Moore.
And I'm Doug Fischesser. Stay healthy, Connersville.